Hello, my name is Kitonga Kiminyo, and I'm an infectious disease physician here in Palm Beach County for the last 18 years. Today we're going to be talking about COVID vaccinations. First of all, why do we need to get vaccinated in the first place? SARS-CoV-2 is the highly contagious virus that causes COVID-19 infection. While there is no cure for COVID-19, we do know that this dangerous virus can affect your entire body, including your brain, your lungs, your heart, and even your circulatory system. It can cause acute respiratory failure and even death. And in Palm Beach County alone, we have had over 2,700 deaths, while in the United States of America, we've had 500,000 deaths, which is significant when you compare it to influenza, which caused approximately 30,000 deaths in 1 year. So we need to vaccinate because we need to generate immunity, because that is the only way to get in front of this viral infection. The vaccines generate immunity that help protect us from the virus, and by so doing protect us from getting sick, getting hospitalized, and even dying from COVID-19. So what are these vaccines? As of right now, we have 3 different vaccines that have been authorized in the United States. Both the Pfizer and Moderna vaccines are messenger RNA vaccines, while the Johnson & Johnson vaccine is a vector vaccine. Essentially, all 3 of them work by introducing a viral genetic code into our body that codes for a very specific but harmless protein. This harmless protein is then recognized by our immune system, and antibodies are produced. These antibodies, or soldiers, are then in our body to protect us in the event that we do get exposed to COVID-19, and by so doing, keep us from getting sick. Now, what are the potential side effects from the vaccination? We know that people have reported a sore arm at the injection site, some tiredness and fatigue, and even mild fever. Please remember that if you experience these symptoms, it does not mean that you have COVID-19 infection. These symptoms generally last less than a day, and the severe, life-threatening events that we've heard about in the news lately are extremely rare. Once you're vaccinated, what happens then? We consider 2 weeks after your last vaccination shot to be the point at which you are considered fully vaccinated. However, you should continue wearing your mask, covering your nose and your mouth. You should continue hand washing and maintaining hygiene. And lastly, social distancing. Please remember that by protecting yourself, you are protecting the others around you, including your family and friends. So we've been getting some questions from younger people about why should I get vaccinated? So one of the questions that has come up is, why should young people consider getting vaccinated? In Palm Beach County, the average age of the positive COVID person is actually 40 years of age. And more importantly, we are seeing that the group of people with the highest amount of COVID cases are between 25 and 44. So we are seeing more younger patients coming in with not only positive tests for COVID-19, but we are actually seeing them in the hospital as well. Now, in part, this is because a lot of the younger patients do have other medical conditions, which put them at increased risk for COVID, including asthma. So what we tell younger people is that while you may not have as many underlying medical conditions as your parents or grandparents, this virus does not discriminate. And we know that this virus can cause a multi-inflammatory syndrome where the whole body can be affected, everywhere from the brain to the lungs to the heart to the circulation system. And we have seen this in patients in the hospital even as young as less than 10 years of age. Furthermore, for a lot of young people, they are living with family members who are at increased risk of developing COVID-19. A lot of younger people have parents, grandparents who do have diabetes, who do have hypertension, and who do have heart disease. And we do know that it is in this subgroup especially where we have seen complications of COVID. So my answer to young people is yes, you should get vaccinated, not only for yourself, but again to protect those family and friends around you, to prevent you and others from suffering the complications of COVID-19. Another question we get frequently is what happens with the vaccinations even though I've had the COVID-19 infection? Well, the short answer is you should still get vaccinated even though you've had the COVID-19. The reason being, we are not sure how long your body's immune system, your body's soldiers or antibodies will last after you've had a COVID-19 infection. What we do know is that after vaccinations, the body does produce antibodies that can last as long as 6 months. And more importantly, with the advent of variants and different mutations, it is important to have those vaccines that cover those variants protect us in developing complications from the COVID-19 infection. So if you are newly diagnosed with COVID-19, we ask that you wait several weeks after your infection to make sure that you are not suffering from any residual effects of the infection. But technically, you can wait as long as 3 months before you can get your vaccination, which we still ask you to do. So in conclusion, I would recommend that all young people, and that includes people from the ages of 16 and up, get vaccinated as soon as possible, regardless of your history of COVID infection or not. Because we are not only protecting yourself, but we have to protect our family and friends that we live with and who live around us.